This week's Ask Dr. Durie comes from a patient wondering about the use of dexamethasone. This patient has been taking dexamethasone 4 milligrams, a relatively small dose as part of the myeloma therapy, and wants to know if it would be possible to even take a small amount every day instead of just 1 day a week. And this questioner says that on the day of the dexamethasone, the 4 milligrams, she feels better, she has more energy, and her joint aches and pains go away, and it could be good to maybe have that little bit of a boost every day. Well, unfortunately, that is really not a good idea because the dexamethasone has a lot of quite serious side effects, and taking the dexamethasone, even at a tiny dose on a daily basis, would really cause a lot of problems. And we have seen those problems, unfortunately, over the years when we have had to use dexamethasone as a more primary treatment when we did not have the drugs that we have available today. If you take a small amount of steroids every day, it can really cause problems such as the development of cataracts, increase the chance of sugar diabetes, certainly can cause some weight gain. It can make the skin more fragile because there's a loss of collagen in the skin. It can even cause some problems with the hips. And so many possible side effects from taking dexamethasone at a low dose on a daily basis. And so, although it's very tempting to have the option to maybe get a boost, get rid of some of those aches and pains on a daily basis, medically this is really not a good idea. And unfortunately, it's best to stick with that 1 day a week. And the bottom line, in fact, is that not only is the daily dose not a good idea, even the weekly dose, we prefer that patients slowly taper off of that if possible, so that the longer term side effects of dexamethasone are prevented. And so dexamethasone, it works against the myeloma, it can make you feel good, but really it's something to be avoided in the longer term.